Now, swift action is required to assist cancer patients from the Charlotte Maxeke Academic Hospital in Johannesburg. That's according to the South African Medical Association. This follows a fire that ravaged the hospital in mid-April. SAMA says doctors don't have access to key equipment as well as patient files housed in a block deemed unsafe because of fire damage. And without urgent intervention from the Gauteng Health Department, these patients won't receive the necessary cancer care. Let's get more now on that story from SAMA chairperson Dr. Angelique Coetzee. Thank you very much, Doc, for your time here on eNCA. Now, I cannot imagine the dangers that these patients face if they are not able to get their chemotherapy, radiation and other cancer treatment on time.
Yes, good morning. You are absolutely correct. This is a grave area of concern to SAMA at this stage because of if you do radiotherapy, that is for patients that's extremely sick that can only get better on radiotherapy. You need to categorize those patients based on the likely severity of the input of the interruption would have on their treatment. So you need to, first of all, if you want to if you don't want to give the radiotherapy, you need to prioritize who are, if you want going to delay, that's a normal situation. Prioritize who you can delay and who you can't. In this case, there's around about 160 patients from the Charlotte Maxeke Hospital. They're not receiving any cancer or radiotherapy treatment for their cancers. Again, because of the lack of files, so some of these files might most probably be destroyed by the fire, or they are being housed in an environment or in a place where you cannot you don't have access to them. But by this time, you should have had access. It's a week or two ago that fire broke out in those areas. So it's a huge concern. It means data might be lost. SAMA had said many times before, we need to look at an electronic health record system that's stored in the cloud that speaks to all the public sector hospitals. So here's now a good example. Maybe we lost this information. Patients are going to die, and it's got a devastating effect on them, on their health, and on their families. We cannot do this.
And Doctor, it also, I think, speaks to, the fact that already in South Africa we have a long waiting list, especially in the public health sector, in terms of such medical care. And now, is this not going to make it even worse?
Yes, for sure it's going to make it worse. So, SAMA again spoke about the lack of oncology, especially, remember, a year or two ago, KwaZulu-Natal was very much in the news regarding this, and they don't have enough oncologists. There's not enough oncologists, first of all, in the country. And we don't see a huge drive to get more oncologists. Then you have these centers where the radiotherapy can be hosted at. For now, only Steve Biko's got their own problems. They have their waiting list. Now on top of it, they now need to look after Charlotte Maxeke Hospital's patients, and we can safely assume that some of these patients are not going to get treatment. They are going to die, unfortunately.
Now, has SAMA spoken to the Gauteng Health Department at all, maybe even the National Department of Health, to see what it is that they're doing? I mean, it's been a couple of weeks now that some of these patients have not been able to get access to treatment.
We are planning now to do that because this only came under our attention that there's 160 patients this past week. So, and we said we need to get it out now in the media so that the people understand that there's a problem with chemotherapy as well as radiotherapy. If the radiotherapy files are lost, I'm not sure whether, it should be an oncology department, so it should be also, your chemotherapy patients. That some of their files might also be lost. And, your treatment cycles is in there, your type of pathology is in there. This is not a case where you can ask the patient, do you know what medication are you getting for your disease? This is much more complicated. So this is, all these little interruptions that one are seeing because of poor maintenance. It's not always the hospital's fault. It is because of the system. The system is wrong. hospitals should be able to look after their own infrastructure and everything that's related to the business of medicine. So now we are seeing that this is not happening. And who in the end is the loser? The patient. They and the families. They are the losers. And we are paying tax money into these, to help and make sure that these systems are working. And it's not working.
Just Summer's reaction very quickly, Doc, on the fact that the Sinopharm from China has been approved to come down here to assist with vaccination. What's your reaction to that?
Well, China can come and assist us, it's fine, but are they going to build out the plants? We need as I've said, there's only one hospital in Gauteng now, and that's Steve Biko. So you can bring in doctors. It's still not going to help us because we still have one unit that can do this. So if we have lots of units that can provide us with chemotherapy and radiotherapy, it means that then we only need to get more doctors trained for oncology. So you can send them wherever you want, but we still have only one site in Gauteng. So what are those doctors going to do?
Doc, I was referring to the Sinopharm vaccine from China being approved.
Oh, sorry, the vaccine.
Down here.
It's not going to help us at such. All these vaccines that we are getting still takes more than 28 days, most of them, before you get immunity. And on the Sinovac, even if you said it's not going to help my cancer patients at this stage, they need the radiotherapy and the chemotherapy. They don't need the vaccine that much. Yes, it will help them, but that's not going to cure to help them assist with their cancer that is now being untreated.